Good morning, afternoon, everyone. Thank you for joining today's webinar. My name is Shabani Ghosh, and I'm here with Patrick Webb. Patrick Webb is the director of the Food Systems for Nutrition Innovation Lab, and I am the associate director. Today's webinar is titled Evidence Needs to Support Nutrition-Sensitive Innovations in Food Value Chains and Perspectives from Southern Asia and Southern Africa. Before we go into the details of the webinar itself and breaking out into panels, let me just give a few logistical items, bring your attention to some logistical items. Next, please. I would like to direct all attendees' attention to a few functions on this Zoom webinar platform. At the bottom of your screen, you should see a chat icon and a Q&A icon. Please use the chat feature to engage with each other in relevant conversation. Please do introduce yourselves. We always love to hear who's attending. You can use one point also to make is if you're unable to hear, please connect your speakers by selecting join audio. If you have any issues doing so, please send us a chat message to the host, and we will make sure that we will get our IT people to help you out. Next slide, please. For the Q&A in these panels, we are going to be using the Q&A feature, and we have allocated the last 35 minutes of this webinar for a joint Q&A between the panelists who are speaking from South Asia and from those who are speaking from Southern Africa. So please do use the Q&A, and if possible, please do indicate either the name of the panelist, or if you want to address panelists from a specific region, please do indicate that in your question. Next slide, please. So with that, let me just give you a little background about the Food Systems for Nutrition Innovation Lab. We are one of 20 innovation labs supported by the Bureau of Resilience and Food Security of the United States Agency for International Development, USAID. The Food Systems for Nutrition Innovation Lab has been active since 2021, and the precursor to this lab, which we call FSNIL, was the Nutrition Innovation Lab, which some of you may or may not be familiar with. But the current Food Systems Innovation Lab for Nutrition is going to be active in Bangladesh, Malawi, Mozambique, and Nepal. And if you click next, please, Jen. Our primary objectives are to support very rigorous research for development in order to generate evidence on potentially scalable food system technologies and practices, support capacity development in partner countries, but also in the United States to generate new knowledge and support teaching and training around such knowledge. And critically important, for the first time, we are also very focused on engaging with not just public sector, but also the private sector and businesses to catalyze scaling and uptake of nutrition-sensitive innovations. Next slide, please. This is our collaborators. We are a consortium of over 20 institutions, US universities across the country, across the globe, as well as INGOs, CGIAR centers that are part of the current consortium. Next slide, please. So let me just take a little bit of a moment to sort of address a critical topic for all of us who work in the space of nutrition and making food systems more sensitive to nutrition, and that is of healthy, sustainable diet. So question when we were planning this event was to ask is, what are some of the needs, and what are the needs when it comes to some of the countries that we want to be active in, as well as the regions we want to be active in. Next slide. Next, please. Sorry, Jen. There are three critical points here. One is we want more production of nutrient-rich foods, and often these are the most perishable foods, as you're all aware. Fruits, vegetables, animal source foods are some examples. We want to increase and make efficient processing, preservation, storage, transport of those foods, so you can protect the nutrients from the product, from the point they're produced to the point they reach the consumer. And lastly, we have to focus on reducing loss and waste, particularly of these perishable foods, given the context of climate change and sustainability that we need to consider as we move forward. Next slide, please. One of the activities that the Food Systems Innovation Lab has been involved in for the past 6 months is to conduct a census of innovations that focus on these 3 topical areas, that is nutrient density, reducing food losses and waste, and ensuring food safety through the process of production, preservation, and consumption. And what we identified was, what you see on the right side is a slide where we've just enumerated across the value chain the kind of innovations that already exist. And many of them have been tested in South Asia and Sub-Saharan Africa. And you can see across, there are different, they range from innovations in agricultural production to innovations in food, environment, retail, and consumer behavior. Next slide, please. The one thing that we did want to point out, and we identified in this scoping exercise, that there are different types of innovations. And when we work in the space of agriculture, we often think about agricultural technologies as innovations, whether they are improved seed varieties, improved practices, but we also have other products such as that support better drying and cooling of the different products that we are trying to preserve, process, and move towards the consumer. The key thing I want to point out here is that what we came across was that processes, which include marketing strategies, includes innovative financing, enabling environment policies, taxation, different policy interventions also were identified as critical innovations that are necessary for food systems transformation. In addition to that, practices around linked to social behavior change, communication, education, training programs were identified as critical innovations, as well as tools such as digital marketing apps, etc. Next, please. Jen, next. Thank you. In essence, this is something that has been identified by the community that works in the space, that we cannot just look at technologies as the innovation, and that we need to go beyond technical innovation to social. Jen, sorry, could you go back? I think we're having some kind of a little bit of a lag here. Jen?
It's showing, Shivani.
Oh, okay. It wasn't showing. Apologies. It wasn't showing on my screen. I think I'm having a lag here, so apologies. So I just want to sort of end on this point that we have to think about not just technical innovations, but also sociocultural policy and institutional innovations to push food systems transformation. Sorry, Jen, now you can move on to the next. Thank you. So within that context, we wanted to bring together a panel discussion and bring together experts from the countries that we are going to be working in, and to understand what are the evidence needs to support the scale up of such innovations across the value chains. And the critical points here are to understand what is the potential for cost-effective scale up of actions and investments across the agri-food system, ranging from innovations technologies to applied science, and what are the evidence needs so that we can support not just healthy diets, but also healthy planets, with a focus on South Asia and Southern Africa. So this was the remit that we have given to our panelists. And since we have 10 panelists coming from the 4 different countries, we have used an approach of dividing the session into 2 separate panels, followed by a joint Q&A. So thank you, Jen, for advancing the slide. And what you see here is the agenda for today. On the left side, you have the first panel, which will be focusing on South Asia context, and I will moderate that session. And on the right side is panel 2, which will focus on Southern Africa, and Patrick will be moderating that session. This will be followed by a panel Q&A and a joint group discussion, with Patrick giving the closing remarks. So without further ado, let me forward and just introduce to panel 1, and introduce our illustrious panelists who have agreed so kindly to join us across different time zones for this event. So the panelists in both sessions, and I should say in panel one, are senior policymakers, programmers, practitioners, and private sector professionals who are gathering together. And in the panel one, we have colleagues from Nepal and Bangladesh. We have 3 colleagues from Nepal and we have 3 colleagues from Bangladesh. What you see on the panel itself is the names of the individuals, the panelists, and how they will be going through the session. So the first panelist to speak is going to be Dr. Kiran Rupakheti. He is a Joint Secretary of the National Planning Commission for the Government of Nepal. He is also the Scaling Up Nutrition or the Sun Country Coordinator focal point for Nepal and a spokesperson for the NPC. He has over 25 years of professional experience in conceptualizing and formulating national priorities, plans, programs on nutrition, social protection, child rights promotion and protection, along with good governance and gender equity. He holds a PhD in technology, management, economics, and policy from Seoul National University and is honored with several national and international awards. Dr. Kiran will be followed by Dr. Manzoor Morshid Ahmed, who is from Bangladesh, and he is a board member for the Bangladesh Food Safety Authority in the Ministry of Food. He began his scientific and research career with the Bangladesh Council for Scientific and Industrial Research in 1996 and has served in different positions, ranging from the head of microbiology laboratory to chief scientific officer. He has served as a consultant and an expert advisor for many international organizations and comes with over 27 years of experience in food microbiology and food safety with over 50 peer-reviewed articles. Ashik Mahfouz is a food technologist from Bangladesh, and he is at GAIN Bangladesh, and he specializes in fortification, nutrition, food processing, and agribusiness. He currently manages the large-scale food fortification and value chain program of GAIN. Prior to that, he was at Nutrition International and comes with extremely high level of experience when it comes to food fortification. He's also served as an agribusiness director for Sylhet region and has been a horticulture consultant for a USAID development program. Under his leadership, the Bangladeshi agro enterprises were able to meet international quality standards and receive the Eurograp and BRC certifications for the first time. Ashik will be followed by Zaman Talukdar, who has just completed his tenure as the country director for HKI Bangladesh. And we're so happy to have Zaman here, despite the fact that he is on a well-deserved vacation. He has worked with HKI for over 25 years and assumed his position in Bangladesh as the country director. Prior to that, he was a technical advisor for nutrition-sensitive agriculture, as well as has supported many food security and nutrition programs in Asia and Africa. He has participated in many research studies and has published extensively in around the space of food security, nutrition, homestead, food production. Zaman will be followed by Atul Upadhyay, who is the Chief Executive Officer of Balio Nepal Nutrition Initiative, a movement that aims to marshal government, private sector, international, and INGOs, civil society, and people of Nepal. Prior to Balio, Atul has worked with HKI International on the ARCH project. He's a journal editor for the Nepal Food Scientists and Technologists Association. And also to note that Balio initiative is the lead for the Sun Business Network. Last but not the least, we have Ram Shrestha, who is a faculty member at Kafudat College in Nepal since 1998. Ram is has been a senior improvement advisor at URC for over a decade. He is a pioneer when it comes to nutrition in Nepal and has established the Nepali Technical Assistance Group. He continues to support community-based maternal child health nutrition interventions across the globe. And he has been recognized by the Global Health Council, by Time Magazine, and by Tufts University, as well as the Public Health Association of Nepal. I apologize for such a long list, taking so much time with their bios, but you must understand we have a very illustrious group of individuals. What I'd like to do is now hand it to Dr. Kiran Rupakheti to give us perspectives from being a Nepali policymaker around what are the critical needs for transforming the food systems to make it more nutrition sensitive. And after Dr. Kiran, it'll be Dr. Manzoor, and I will interject in different points so that we can move along and have all the panelists give their perspectives. Thank you, and over to you, Dr. Kiran.
Thank you, Sibaniji. Thank you very much. I'm really honored because of the Wi-Fi situation. I'm turning myself off. Sorry for that. And I'm really honored. And I will have my thoughts in two segments. First, I will shed light in brief about the existing situation in the country. And then after, I will jump over to the few of the issues I would like to highlight. And most importantly, I should say that Nepal is in the process of drafting next phase of multi-sector nutrition plan, that is multi-sector nutrition plan third, and I'm sure that the outcome of this event will be immensely important for us. Nepal has made good progress in improving food security and addressing malnutrition. Still, the existing situation is not satisfactory, I should say. Stunting among under 5 children is 31.5%, wasting 10%, underweight 24.3%, anemia among women of reproductive age is 41%. So this is a situation, actually, this necessitates us to work further in this direction, and today's dialogue is going to be very important. Now, further, COVID-19 has unprecedented impact on livelihood, food security, and nutrition and well-being of population. Both formal and informal, micro, small, and medium enterprises are hard hit by the pandemic. Of them, many were related to food and nutrition. Considering this, greater attention is needed to improve children's and women's access to nutritious, affordable, safe, and sustainable diet in ways that address socioeconomic, socio-cultural, and geographic inequalities. One of the major issues I would like to highlight over here is affordability, which is an important aspect in the food chain. Recent analysis found that the lowest cost nutritious diet, one that meets energy and micronutrient requirement, is around $2.64 in terms of US dollar per high person household per day, while the cost of a diet that meets only energy needs is around $1.06. While almost all households in Nepal are able to afford the lowest cost energy only diet, at least 22% would not be able to afford the lowest cost nutritious diet. So highest rate of non-affordability, over 60%, are in the remote mountain areas of the country. So let me go to the private sector engagement, which is a key to contribute for production, processing, effective distribution for increased access to affordable healthy diet. However, private sector is driven by profit by the inherent nature of the sector. Constraints exist at different level of food value chain, and both at the production, processing, and distribution level, along with limited access to market, credit, and information, and poor infrastructure. The complex relationship that must be considered in nutrition sensitive value chain is a delicate balance of economic, social, and environmental impact, including greenhouse gas emission. Government has a role to facilitate and regulate the private sector and have judicious trade-off in profit and social goals, supporting private sector through investing in infrastructure development, enabling environment, and easing doing business, which in many cases seems to be the barrier to flourish private sector engagement. It would be the catalytic action to motivate private sector. So in this regard, government has been trying to invest in the infrastructure development, devising policy and procedures related to subsidy, grants, minimum support price, etc., to facilitate increased investment from the private sector. This has been managed through 15th plan, which is underway at the moment, multi-sector nutrition plan second, which is underway at the moment, and sectoral policies and strategies. However, I should highlight them that they seem to be grossly inadequate. In this regard, I would like to highlight the importance of R&D as well, important aspect, as this provides powerful knowledge and insight, which leads to improvement to existing processes where efficiency can be increased and cost can be reduced. So development of infrastructure, let me add with the importance of the technology, especially Digital Nepal framework is underway at the moment, but we have not been able to harness the benefits of the ICT technology in this area. And let me go to the, another point is about the evidence and, for the policymaking process. The demand for evidence on food security and nutrition situation has been increasing over time. However, the poor information flow as a barrier for using research and decision-making process. This is further limited by the recent change in the governance structure due to the federalism, which we have adopted lately, and many institutions at the subnational level do not have the capacity and skill. And more than that, let me highlight, which will be reflected in other countries, that there is a limited cross-linkages, coordination gaps between researchers and decision makers, and inadequate transition of research evidence into meaningful information for the policymakers. So at the end, I think I have already consumed 5 minutes, but let me conclude by saying that the government of Nepal is implementing the 15th plan at the moment. And we are trying to increase the production and productivity in the agriculture sector, and also by reducing the time and cost of transportation and transit, improving the regulatory system and reducing the transaction cost of doing business. And in this regard, we have done some initiative at the moment, that is UN Food System Summit 2021, COP26, Nutrition for Growth Summit are a few examples that have wide impact at the national and global level to push the agenda of healthy diet, healthy planet, and prosperity. So with this, I would like to stop over here and don't want to take much more time. I will be here to respond further. Thank you. Shivani, back to you.
Apologies, I was on mute. Thank you very much, Dr. Kiran, for outlining very succinctly what are the actions that the government of Nepal is taking, but also what are the challenges and the way forward and the solutions that might support the transformation in Nepal. On that note, maybe Dr. Manzoor, would you like to please come in and give us the perspective from the context of Bangladesh, but as well as the perspective from your work around food safety? Over to you.
Thank you, Shivani, and thank you all. This is Manzoor. Greetings from Bangladesh Food Safety Authority. It's a pleasure to be a panel discussant at FSNIL side events of FAO Science and Innovation Forum. So, given the 5 minutes, let's focus directly to the a few priority areas related to South Asia, especially in Bangladesh context. If we talk about the innovation in food value chain, most of the region in South Asian region, including Bangladesh, the agricultural and food research and innovation has been focused primarily on production, because we have a lot of population and we need to feed the people. So production is the first priority. And yield, production, all these things, research has been done. But if we consider the innovation on food value chain and the supply chain management or nutrition sensitive or quality and safety sensitive issues are relatively low in my notice. So if I talk about the policy point of view in Bangladesh, you see that there are lack of guidelines, inadequate policies related to nutrition and food safety, as well as the post-harvest management, post-harvest loss, nutrition retention, packaging. All these issues are very related to the safety, and all these relations are actually pinpoint issues for the government policies. If the government policies do not exist in time, then innovation and investment is actually hindering. That has been occurring in Bangladesh, I would say. But recently in Bangladesh government, we are focusing nutrition and food safety issues very much. That I can say you. If we consider the NGO, INGO, and private sector investment, that is also coming through the public-private participation. And this public-private participation and investment is actually has given more focus nowadays in Bangladesh. You know that Bangladesh Food Safety Authority established in just 2015. This is also a kind of government signal that we are trying to maintain the quality and safety of food. This is related to your nutrition. If food is not safe, the nutritious food is also not giving you any benefit for health. So this is, government is integrating all these things and private sector is coming up. But the issue is innovation investment is not occurring that much in that sector. It's my understanding, but we are trying to focus in these issues if we consider about that. You see, the Bangladesh already promulgated in 2020 the nutrition and national food and nutrition policy guideline. So this actually has engulfed all these issues. And also the 8th 5-year plan. Bangladesh currently is 8th 5-year plan. And we are focusing very much with sustainable development goals. In most of the 17 sustainable development goals, all these issues are actually incorporated. So looking to all these policies, national and international, Bangladesh government is looking to address all these issues. But there are some issues still, you know. If we consider the science and technology point of view, I mentioned earlier that the scientists are actually taking projects and research based on yield and production. And there are less emphasis on, you know, food value chain innovation and food value chain sustainability, so that the people can have good food or nutritious food after its production. But unfortunately, in Bangladesh, I would say there is a lot of post-harvest loss still. We do have a lot of nutrition loss during our food value chain and food supply chain. So all these things we are addressing currently. So I believe that Bangladesh will get a good progress in this point of view. Then another thing, why this research and innovation is not occurring in this particular point of view is actually kind of mindset that we have from our previous days, that we need production and we need food supply rather than considering the food quality or food nutrition, all these things. But currently scientists are changing their mindset, because Bangladesh, I would say, more or less self-reliant in cereal products and all other foods we have. If you consider that 165 million of people, sometimes it's say 170 or 165 or 170 million people within these very small arable lands, we are producing a lot of food products. So considering the production, sometimes the safety and nutrition issues are less important. So these are the things I can give attention. In consideration of population, I think we are doing well, and the government is doing a lot of policy interventions so that innovation and nutrition related things can be done. And another important thing is we are focusing on children education, mass education regarding the nutrition and food safety and food quality. And this has been started from the primary level students to much population, so that people can understand the importance of nutrition, and they can use the diverse food products, because food products are available, but less of knowledge about the diversity of intake and nutrition related knowledge, they are suffering from malnutrition or some kind of issue. So this knowledge actually we are trying to disseminate in the whole stakeholders. These are the issues we are currently addressing, and the Food Safety Authority is also incorporated with all these activities and policy issues, as well as the Ministry of Food and Bangladesh government. We have a lot of interactions with the scientists and other people, so that we can integrate all this. I think time is very limited. I can finish here if I have any.
Thank you, Dr. Mansoor, very much appreciated. And I think we can come around with any further comments, but I would like to pass over to Ashik, who will come from the perspective of having worked quite a bit on fortification, on sort of enhancing the nutritional content of food products in Bangladesh. So Ashik, over to you.
Yeah, thank you. Thank you for inviting me, as I'm one of the panelists to represent South Asia, particularly low middle income countries. It is a pleasure and honor to be here. This is a very useful topic to discuss about how to produce more nutrient-rich foods process and preserve them all the way to the consumer and cut loss and waste for ensuring healthy diets for the population in this region. And definitely this requires an urgent focus on innovation, technologies, and applied science to scale up actions and investment across agri-food systems. As my previous speaker, Dr. Manjur, she mentioned that our main research is focused on the production and productivity of primarily agri-product, but access to safe and nutritious diets for all is a priority commitment of the government of Bangladesh. However, food intake continues to be cereal dominated. That's an issue. With per capita daily intake of pulse, vegetables, fruits, and animal source foods remaining between a quarter to one half of recommended intake values. There is prevalence of micronutrient malnutrition and increasing incidence of overweight and obesity. So I'm sure you all are aware the recent Lancet Global Health Report published on just 11 October 2022 shows that over half of preschool age children and 2/3 of non-pregnant women of reproductive age worldwide have micronutrient deficiencies in at least one micronutrient like iron, zinc, or folate. Once we factor in males and other age groups, such school children and elderly, these numbers will be much higher than current global estimate of 2 billion people suffer from hidden hunger. Maybe it will be 3 billion or more than that. Our immediate focus must be providing nutritious food for all those people who are struggling with hunger. But we must also retain our focus on the imperative of the changing of food system. Food system must deliver more nutritious food to population. For food system to do so, value chains of micronutrient-rich foods must be improved, making such foods more available and affordable to consumers. There are, however, issues to address such as excessive fertilizer and chemical use in food production, inadequate mechanization, need to promote good agriculture practices among farmers, and need for greater linkage of research and development with agriculture extension and agri-food system modernization, including use of nanotechnology. Considering the prevalence of micronutrient deficiencies, the government of Bangladesh has been emphasizing food fortification, both crop biofortification and industrial fortification through different policies. Bangladesh has enacted the Edible Oil Fortification Act 2013 and Salt Iodization Act 2021 for mandatory fortification of oil and salt with micronutrients, and has made provision of industrial fortification of rice and other staples. To achieve nutrition outcomes, social behavior change, communication needs to be integrated across nutrition-specific and nutrition-sensitive interventions. Increased consumption of affordable, diversified diets. Awareness is also be generated on overweight, obesity, and increasing incidence of non-communicable diseases. Recently, I have seen that a Singapore-based food tech startup developed meat alternative from jackfruit. There are some countries where more than 50% jackfruit goes to waste. There is substantial food and nutritional loss along the agri-food value chains arising from harvest and post-harvest losses due to inadequate infrastructure and lack of updated technologies, food spoilage, expiry, improper cooking and eating habits, and inadequate waste segregation and disposal at critical points are among the reasons for food storage. Reducing food loss and waste, a target under SDG 12.3 is priority agenda for the country. This will include investment for resource recovery and reuse, which includes the promotion of mechanization, affordable climate smart loss reduction technologies, and on-site food processing and waste recycling technologies. Awareness building, shortening of the value chain, and encouraging consumption of locally produced food, including indigenous food, need to be undertaken to reduce food loss and waste. With these few words, I am concluding my remarks here. Thank you.
Thank you. Thank you, Ashik, so much. I think it's really important to highlight to our audience that really what's really emerging is that there are clearly needs around infrastructure, around investments, about linking private sector better to investments and enabling private sector to support the production of healthy, nutritious foods. And I think, thank you, Ashik, for pointing out that there is still a huge emphasis on production of cereals and staples, which are important from a food security perspective, but often because of that, nutritious foods do get sidelined in many contexts. So on that note, I was going to ask Zaman Talukdar, if you don't mind coming in and giving some of your insights of the work that you have done trying to really support nutritious diets through homestead food production and all the activities that HKI has been involved in Bangladesh.
Thanks, Shivani. Good morning, everyone. Thanks for inviting me in the panel to talk about our experiences in South Asia, particularly in Bangladesh. First, previous speaker already mentioned about our, achievement in the country. Actually, in Bangladesh, all we know that there is a tremendous development in terms of production sector. If we look at the vegetable production, this is the third position in the world now on vegetable production. Similarly, fisheries and livestock production has also increased. So if you think like, feeding 200 million, about 200 million population, it's not easy. So this is something actually Bangladesh great achievement in terms of production. However, I think that we all know, since this meeting is we are talking about nutrition sensitive innovation. So we have to think about the nutrition. Our previous speaker, Dr. Manzoor, as well as Dr. Ashik mentioned that, we have to think like how we can get the maximum benefit from food for improving nutrition, because production increases does not necessarily always mean to improve nutrition. So we have to think about other issues to maximize the utilization of the food. For example, like all those non-cereal crop, how we can improve or access to the increased consumption. At the same time, like how we can increase the diversity of the diet. Those kind of things are there. In terms of production, I think that we also need to focus more, like other domains of the utilization of the food. For example, storage facilities, transportation, food processing, and proper utilization. So these are the areas actually we need to do more work. So if we think about the sectoral coordination, health sector and agriculture sector, I would say in the last decades, there's a lot of in the last more than 10 years, there's a huge improvement and development, the coordination among the sectors. And one of the great success we have right now under the Ministry of Health, there is Bangladesh National Nutrition Council, which is chaired by the Prime Minister. So this has been formed by 23 ministries. So this is one of the best example, I think, that multi-sectoral approach. So this is something actually we need to integrate more with the private sector. So that's the way I think that other components of the food, like food processing to marketing, utilization, those kind of things actually, if both private sector and public sector works together. Another point I would like to highlight, mention here, like young professionals or workforce development. This is one of the area we have a lot of achievement. Almost all the districts throughout the country, we have the training center for this, with a minimum training like they can go back and develop their entrepreneurship in terms of different agriculture sector. However, we need to do some more work how we can utilize them for commercial enterprise and link with the market. So these are the good things we have, but still I think that we need to do some more work for the young workforce who are the future of the country in terms of food system. So we have some challenges, of course, like policy to implementation. I think that there are some evidences. We need to do some more research. At the same time, policy formulation, I think that both private sector should also involve with the public sector to formulation to the implementation, like good governance, market governance, and proper management in the food system. So if we develop this policy and then together with the private sector at the same time implement together with the private sector, we will be much more benefited. So this is the things, and post-harvest already mentioned, there's a huge loss, and this is something Agriculture Research Institute, they are working, but I think that more it translates to the development sector, especially at the farmers level, how we can reduce it and what are the practices need to change so that we can reduce the post-harvest loss. So these are the things are there, and I think that all the agriculture sector, including livestock and fisheries research institute, all those sectors actually need to involve more the private sector, because we have seen the last 10-15 years, like private sectors are very active now, they are moving forward, so we cannot ignore their role on overall development of the food system. So this is all about my perspective, and I think that we have more opportunity. Again, I would say like multi-sectoral approach, nutrition. If we talk about the nutrition, we have to think about the multi-sector and how we can bring and work together with the private sector. Thank you so much, and over to you, Shivani.
Thank you, Zaman, so much. And I appreciate the point that you made about the fact that there is, in Bangladesh, agricultural production is highly developed, especially with perishable foods and nutrient-dense foods. I want to sort of pivot back to Nepal. We had all the speakers from Bangladesh, and I feel like let's go over to colleagues from Nepal. And Atul, I think your initiative is really at that crossroads and is trying to address all the points that were raised by the previous colleagues about linking government and public sector better to private sector and the consumer. So over to you, if you can give your perspectives as well. Thank you.
Thank you, Shivani. First of all, I'm really pleased, honored, privileged to be here. I have been listening to the panelists and also looking at the chat questions. Whenever we talk about the food system in Nepal, and when we want to use the private sector term, that's what Balio Nepal is doing at the moment. I see three sides. One is the demand side, the consumers, the supply side, the manufacturers and producers, and the regulatory side. So in this discussion, I shall be dividing my talk into two sections. One is the challenges that we have in Nepal and what we should be doing. So basically, as Dr. Kiran also said in the first speech, that Nepal is improving, significant improvements. We have lots of policy framework from the constitution to the MSNP3, policy documents, but are these policies really translated to the actions? That is one question I always feel. I believe that food and nutrition safety and security in the country is still under par, no doubt about it. The second point that is beauty of this country is the ethnic diversity that we have, the rich eco-diverse system, the rich food culture, the healthy and nutritious traditional food habits, indigenous food habits. One side, the other side is urbanization, westernization, and labor migration. So we have lack of resources, human resources is reducing. So the entire thing is that our country food system is import driven. So whatever we get from outside, right? So we are compelled to absorb whatever is available in the market. The third is what I see is the agricultural practices, the environmental effect on when we say food system, right? The injudicious application of pesticides, the hormones, the antimicrobials. So these has led, if you look at the household, each household almost has a diabetic patient, a hypertension, a thyroid, some sort of thyroid, or some sort of cancer. Why is this happening in this country? And also the reluctance of private sector to manufacture nutrient-rich food, primarily due to the competitive importing foods. So these are the factors that are really creating some issues. And there are people who are aware on this nutritious consumption, but then again, there is knowledge practice gap within the consumers. And the fourth thing that I always find challenging in this country is lack of efficient food safety, nutrition, data management system. I mean, we don't have those kind of things. So to address all these things, I propose, and even I always say Poshan mantra whenever I advocate all these things, I propose few things. Now, first, to increase the availability and accessibility of nutritious and safe foods. I see that we should do some research on formulating and reformulating processed foods using locally available raw materials, the indigenous technology that we have, the ethnic foods we have, in collaboration not only with academia, but with the private sectors who are the real manufacturers, with the food scientists, with organizations like Nepal Food Scientists Association, and market experts, business experts, right? And there comes the concept of aspirational marketing. It's not about educating marketing, but aspirational marketing. The first thing was that. The second thing is that to improve the agricultural practices, we should conduct some surveys on the use of pesticides, hormones, and antimicrobials that are currently being used, and also to minimize the post-harvest losses or waste, the food waste. There should be some concrete work to be done so that there will be an abundant amount of safe and nutritious food. And the third that I would like to also suggest is to develop a digitalized food safety and nutrition data management system. This particular platform would be a place where everyone, the entire actor of the food system, the value chain, can go there and see if there are any evidence present, and so that they can get information and all those things. I think these are the main things that I would just like to highlight. And if there's any additional questions, I would love to answer. Thank you so much.
Thank you, Atul, so much for bringing this all together. Really, really great comments. I do think that I wanted to highlight the thing that one of the things one has to be careful when we're thinking about reducing food loss and waste is not have unintended consequences of things that shouldn't be used to preserve food. And my colleagues in Bangladesh clearly are familiar with this issue, as our colleagues in Nepal, about the kind of chemicals and pesticides and hormones that are likely to be used to preserve and lengthen the shelf life of foods. So we have to work on that as well. So if we are trying to reduce food loss and waste, we have to be careful on how it's being done. So thank you, Atul. And I want to sort of go to the last speaker of the panel, keeping track of time, and hand it over to Ramji to give us his thoughts and perspectives.
Thank you, Shivani. This is very good opportunity to talk about, I think I will be, sharing my experience, working at the lower level, like the district and the community level, and looking at the challenges for combating the food system, safe and quality diet, So from my experience, what I have seen that, because our previous speakers have already touched everything, so I will touch very simple things, the relationship is very complex between food system, and food quality and food safety, right? That's a big challenge, and there need to be a very good operational research to really look at it, where we should be really focusing on. Another thing is, increasing prevalence of processed food, because of that, it has a very low nutritional value, right? So it is available, if you can see them in the market, but people are consuming, especially the children, young people are consuming it, but it has a very low nutritional value. So we really have to understand, we have to look for the value chain, but at the same time, we have to be very careful that it has a nutrient content there adequate. And the third, I look at the challenge as, nutritious food are becoming, in Nepal especially, becoming less available, and not affordable, for the poor and vulnerable groups, because Atulji has already mentioned that one, right? And also it's for young people, they go for more fast food and other things, so it's kind of not desirable, right? So these are the basic challenges we see in Nepal at the municipal level, at the urban and local level, right? And I think Dr. Kiran has already mentioned that in Nepal we are really moving with the MSNP2, which really brings all the sector together, right? And that has really can address the challenge of relationship, complex relationship between in the food system, right? So looking at those challenges, and the work I have done in institute, academic institute, and with the community, what I see that as Atulji has also mentioned that in Nepal we have a many policy, very good policy, right? But they have not been implemented at national level in larger scale. For example, food fortification, food safety, and food quality. So there are the areas where the studies or operational research can be done. How could it be scaled up in Nepal so that food could be available and reachable to poor and vulnerable groups, right? The second part, as I have been involved in the institute, academic institute, I see that building the capacity of research capacity in lab as well as in field, for food technology, dairy technology, and nutrition-related institutes, right? Because there are institutes in Nepal who has been producing bachelor and master level students. They produce different kind of food product, and they also do a lot of research, but because of the lack of technical support to them or capacity, they have not been able to really bring the local context or local issues, and work on that one. And when they write the thesis, they could really do the research on those parts. So I think it's very potential, and it's a very good area where research or capacity building can be done, so that because these are the people who will be in the policy level, who will be in the implementation level, who will be in the industry, private sector, everywhere, right? So bringing a very good researcher in this area, or very good innovative person with the technical skills could be helpful in Nepal to solve the challenges has been talked about, And third thing I think is, like the CAFEDAT college, who has also been in, getting involved with another academic institute, and they do a very good tissue culture activities, for quality and nutrient-rich foods, right? So I think that's also one of the area where the research or studies or innovation can be done for biofortification and biotechnology. So these are the areas I think Nepal really needs, in policy implementation, doing the operational research, and trying to find out, which can be scaled up. And the another could be the building research capacity of academic institutes. And third could be doing some kind of biofortification or biotechnology innovations. So I think in my experience, that could really help Nepal to move and achieve the goal what government has set. Thank you.
Thank you so much. Thank you. I'm trying to summarize everything that six of you have said, and I want to do 30-second summary. I apologize because I need to move over the session over to Patrick, but I thank you, all of you. This has been a fabulous panel. R4D, capacity development, investments and incentives for private sector, infrastructure investment, demand generation creation from consumers, You all have identified all of these specific points across both countries. Of course, there are challenges, but there are also opportunities for reaching such a large and diverse population in both Nepal and Bangladesh. I won't take any more of time because I'm 5 minutes over on this panel. So I'm going to hand it over to Patrick, who is going to take over for panel 2. Thank you all. Everybody stay on board. We've got another exciting panel. Over to you, Patrick.
Thank you, Shabani. Yes, we do. And clearly the chat is generating a lot of excitement back and forth, both in terms of posing questions and in some cases offering solutions. So you know, we need this conversation. There's no question, and I'm excited to hear actually policymakers and scientists talking about private sector actually in positive ways for a change in terms of, you know, we need this engagement. We need to find ways to work together. So we're running just a little bit behind time, but we're absolutely fine. I'm going to just very briefly introduce, in short terms, our distinguished panelists from the Southern Africa region, starting with Sophie, who's with the Alliance for Green Revolution in Africa, AGRA's country manager in Malawi since 2017, and she's worked in at least 18 countries in Africa and recently played a key role in leading the multi-sector stakeholder approach, the various dialogues that underpinned the national food systems dialogue process. Then we have Gaspar Gwambe, who's Mozambique country director for GAIN, the Global Alliance for Improved Nutrition. Welcome, Gaspar. And for 2 decades prior to GAIN, he served both in Mozambique and in Angola, for example, as deputy country rep and director of admin and finance for an international NGO, working mainly in the program and design and management area. We're then lucky to have Professor David Shirley, who's from Michigan State University, member of the core technical team of MSU's Global Center for Food Systems Innovation. He's a very well-known thought leader and researcher on many different dimensions of food security issues, and has spent time with long-term assignments in places like Ecuador and Mozambique in the late 90s, and focuses a lot of his work these days in East and Southern Africa. And then we have Edna Posolo, who's with the World Food Programme, WFP program specialist. Edna was before that with Mozambique's Ministry of Health for 10 years, as head of the Department of Nutrition and the national focal point for Codex Alimentaris. So she joined WFP just a few years ago, and she's overseeing nutrition and HIV related issues for WFP in Mozambique. So without taking any further time, I'm going to give the floor over to Sophie, and in the same way as we heard from Nepal and Bangladesh, welcome you and encourage you to share a few thoughts on salient issues, and then we'll go more into Q&A after that. So over to you, Sophie.
Thank you so much, Patrick, and thank you for the opportunity to speak around this very important topic. In our experience, what is very important is how governments can put together policies to guide everyone on key agenda points like a unified goal. So a call for action that was done by the leadership of Malawi, and also convincing everyone that we have a problem at hand. Our nutrition and our diets are not up to date, even though all along we have been working on this. It's not enough. So once that happens, who is there? The key players that can contribute to this, moving this forward to action to address the issue. And also bringing on board the researchers, the policy makers, even the communities, chiefs and everyone to shape the agenda to say our nutrition or our diets need to be redressed. Private sector players should be part of the process. And so because of rallying everyone on board, then we have data that informed us that in Malawi, there is inadequate access to affordable and healthy diets and healthy and sustainable consumption patterns. degraded natural resources and environment, supply chain challenges, limited resilience, but also on the quantitative side, that 70% of the diets of Malawians is comprised of cereals, tubers, and roots, and not enough of vegetables, fruits, and legumes, for example. So what do we do? And that there is also 23% of child deaths because of lack of proper nutrition. And also 39% of stunting as of 2018. And there's a lot that we need to do, a lot of statistics and data that and evidence that triggered everyone to go into action. Now, after that, also realizing that in order to move forward, if there's a lack of policy guidance, lack of implementable food systems strategy, we need a strategy to even talk about what resources we need to address the situation. Lack of funding, another key issue, limited technical capacity. And also when we look at the local production and innovations, what can trigger the private sector to jump on board and then contribute to addressing the situation? We need evidence highlighting that there's a major problem. We need the previous successes from elsewhere to be adapted to every local situation, resources and access to sustainable markets. For example, sometimes in other locations, you have adequate food produced, but then it just requires an efficient market system that should move food from one location to another. We need the right transportation system. So even the contribution from multi-stakeholders, even transport issues, cold storage chains, and realizing that in Malawi, for example, in the past, we did not emphasize the role of small fish as a key nutrition diet. So feeding into the school feeding programs, but looking at from the breeder's side, what is it that is being prioritized as early generation seed, like high iron beans and fortified maize? And if it is the breeding has happened by the agricultural research stations, how does it move to the user and consumer? How does private sector come in to bring in a private sector approach and business approach and incentivize everyone along the value chain so that everyone is benefiting for a nutritive health and the sustainable diet in the whole country? Yeah, I hope it's 5 minutes over already.
Thank you, Sophie. Yeah, that was very, very concise and covered, wow, a lot of issues. And thanks for bringing specific food examples to the table, so to speak. Yeah, we do need to be thinking about the entire supply chain challenge. Gaspar, I'm going to hand over to you for your few comments to begin with.
Right. Thanks, Patrick. And say I feel honored to have been invited to this forum to bring perspective, especially from Mozambique. So in Mozambique, over 70% of households live in rural areas and rely primarily on agriculture for food and income generation. So though in these areas, fertile land is in abundance, this community live under extreme poverty, and stunting is affecting 38% of the children under 5, mainly due to limited agricultural development, limited access to markets, weak productivity of food crops, and high levels of loss and waste. So one of the main reasons leading to this is related to the fact that Mozambique food system in general is broken. So the country has difficulties in producing, storing, processing, distributing, and marketing more safe, nutritious foods for everyone. So to overcome this challenge, the country needs to invest in the technological transformation of food systems, considering that food is fundamental in contributing to the improvement of nutrition status of the population and consequently in the improvement of their health. So 3 dimensions should be therefore be addressed to contribute to the technological transformation of food systems, and thus impacting on the quality of the diets and nutrition of Mozambicans. And this is related to the first dimension, engaging policymakers to improve legal and policy environment that will stimulate investment. This intervention should aim at increase the action to facilitate the attraction of investment for food systems, including more attractive policies and tax and benefits for sector development, as well as for import of technology. For improved quality and safety, policymakers should consider the gradual but effective implementation of regulations that promote the production and distribution of food meeting minimum quality standards. It's our role to contribute to building awareness of the policymakers about these areas, as well as to bring evidence that changes in policy can contribute for the transformation of food system and ultimately increase the health and nutrition status of the population while contributing to more income generation for the families. On the dimension of research field, there are relevant actions in place now with the government leadership. Nevertheless, there are relevant questions we need to answer, such as, does the country have enough technical resource to allow innovation to take place? To what extent is the private sector interested in investing in technological innovation? Is there availability of capital to invest in innovation within the food systems? So on the level of implementing the private sector, I just want to cite a recent Sun Business Network survey of food systems company in Africa and Asia, including Mozambique, found that for 65% of respondents, one of the main challenges they faced was linked to difficulty to access to finance. In Mozambique, this business also pointed out that limited technical assistance, poor business management, food production and processing practices limited their capacity to innovate and increase their production and productivity. Presently, the global crisis caused by Ukrainian war that is affecting the world, resulting in food crisis, should not be seen as a challenge for Mozambique, but as an opportunity for the country to invest in technological development, in the increased investment and in accelerating implementation of the measures the government has established for improvement of business sector in the country. The country should not only look at expanding the production of traditional cultures, but make a bet in crop diversification, as well as increasing the actions aimed at generating demand for consumption for safe, nutritious food products. In pursuing such opportunities, government, private sector, donors, civil society, academy, and other stakeholders in Mozambique and Southern Africa should focus on the definition of strategies that stimulate fast policy changes that are easily translated into action, foster investment for research and innovation based on the local context, and create an enabling environment that leads to transformation of food systems, hence contribute to improve the diets and nutrition of all population. So thank you very much, and over to you, Patrick.
Thank you so much, Gaspar. That was, again, very thoughtful, and that idea of not wasting this moment, this crisis that we're all in, but use it as a moment to rethink what has been the past and what could we do differently in the future, retool as individuals, institutions, countries. I think that's something we have to dwell on. Hand over to Dave Shirley and get your thoughts on this complex domain, Dave.
Okay, thank you very much, Patrick. And looking at the lineup of people that have spoken, I guess I'll consider myself an honorary Mozambican, where I did live for 3 years and worked for many years. But I'll say that my comments are going to draw more broadly from my work across East and Southern Africa over the past more than 2 decades. So I have one overall point that I will then elaborate on a bit with kind of 3 subpoints. My overall point is that we need much better understanding of the systems in which we're trying to promote innovation, right? And in particular, we need to know many things, but in particular, I think we need to know a lot more. And I think an earlier speaker talked about how we've worked on this for a long time, but we still don't know enough about some of these things. So my three things are: what do people eat? Where and from what kind of vendors do they obtain it? And where do they eat it, right? That's the second. And third, how these foods get to the retail vendors where they obtain it. Okay, so three areas. I'll elaborate a bit more detail on each of those three, but then I want to make a second overall point about how we go about doing this. And I think that this knowledge needs to be created with our local partners in local institutions, local organizations. It's wonderful to have the AGRAs, to have the GAINs, to have the Helen Kellers, to have the Michigan State Universities doing this kind of thing. But increasingly, it's our local partners embedded in local organizations that need to be asking the questions, generating the information, because it is really only them in the end that can build this into the policy making process and influence more effectively the kind of decisions that get made. Okay, so coming back to my 3 points, we need another way of making my broader point is that we need to link better data on the demand side with knowledge of the structure, conduct, and performance of the supply sources. Okay, so in our first area, we need better quantitative data on what foods low and middle income consumers are consuming. And this needs to not just be commodities. We need a tractable but more detailed categorization of the types of purchased processed foods that people are consuming, right? And the big problem is that there is an almost infinite number of types of processed foods or of individual processed foods out there. And that problem only gets worse as modernization proceeds, right? So we need to do this against some kind of agreed categorization of these foods that captures nutritional quality, because not all processed foods are unhealthy, right? So for example, can we use something like the relatively new global dietary quality score to, as a group of researchers and policymakers, come up with some kind of standardized categorization of processed foods that adequately captures the healthiness or lack of healthiness of those foods, okay, and build this into standardized data collection, okay. We need to do the same kind of thing for food away from home, which, if anything, is even more complicated. Food away from home is a very important source of foods for many urban and peri-urban dwellers in Africa, and we don't know nearly enough about what the actual budget shares are, and then the nutritional quality of those foods. We need a lot of work about how to get better data in a tractable way from the food away from home sector. Okay, so that's the first point about data on what people are consuming. The second thing is where and from what type of vendor they're getting these foods, right? So again, we need to pay a lot of attention to in-home versus out-of-home. We need to have a disaggregation of the types of informal vendors that are out there. The informal sector remains extremely important in providing food to urban and peri-urban consumers. And I would say, although I was a bit of a skeptic 20 years ago of some of the stories about supermarket revolution, I will note that our data on market shares of supermarkets are about 20 years old. And certainly that sector has evolved quite a lot. It's diversified quite a lot. And at least in some areas, it seems that it has grown its market share a good bit, right? So I think it's time to get some updated estimates of the different types of supermarket formats out there, where they're located, what they're selling, and what their market shares are. So that is the second point about the types of vendors where consumers are getting their food. My third and final point then is about the structure, conduct, and performance of the system below retail level, right? So there's many things we need to know here, but I'll just mention two. One is that we need at least rough estimates of the flow of different types of product through the set of wholesale and retail markets that are out there, right? the flow through processors, and then these direct, to retailer flows, because we'll have, retailers of vegetables, for example, that may go directly to farmers in peri-urban areas. And we don't need to be exact, but there are methods. I've developed some of those methods and used them in sporadic kind of ways. There are methods to cost effectively generate this kind of quantitative market map of an urban, peri-urban system, including reaching back to supply areas. So I think we need to deploy these in more systematic ways at the outset of some of the research that we do. And then finally, my final point here on the structure, conduct, and performance. And again, there are many things, but my second point, we need to know more about the seasonal variability in price and availability, and I guess I would add quality of key foods by retail outlet types. Do different types of outlets become more important seasonally because of the kinds of supply chains that they have and their ability or inability to continue to source foods during short seasons, right? So I think I may have used less than my 5 minutes time, but that's fine. Thank you very much. I really appreciate being included in this and having a chance to share my thoughts.
Yeah, thanks, David. Important to bring the focus on, in wanting to make things different, what are the evidence needs? Where are we building from or wanting to change from? And there are some significant gaps in our understanding of the dynamics of the systems that you're talking about. So thanks for bringing that to the table in terms of there are lots of evidence needs to help support the kind of ambition that we're talking about. So lastly, in this session, Edna, I will turn over to you to give your thoughts from an organization that is known for its humanitarian work globally, but also involves a lot of supply chain and innovation work in markets to achieve its goals. So Edna, you have the mic.
Thank you very much, and I hope you can hear me loud and clear. And again, I joined the other panelists to say what a privilege to be in this discussion. I, of course, fully agree with the points of all the panels have made. I wanted to start by highlighting also from a healthy diet point of view that in Mozambique, of course, as similar to other countries, the key concern continues to be to tackle the different undernutrition problems, but we also already see a sharply rise in non-diet-related communicable diseases. And when we look at the data that is available, we know that the majority of malnutrition problems is concentrated among the poor, which are also those that live in rural areas. And those in rural areas, they depend mainly on food that they produce from their own production. And this is characterized by cereals and green leaves, vegetables, and with the absence of animal source foods and limited processed foods. On the other hand, we are seeing already an increased dependency of having the urban consumers or populations mainly dependent on the foods available in the market, which are mostly processed foods. And we are seeing these areas a more and more increase in the tendency to include street foods, snacks, sugar-rich foods into their diets. So when you look at the healthy diets, it's important to also that in the context of countries such as Mozambique to acknowledge this factor and how then the efforts to diversify the food consumption and production, we also look at how to control the consumption of this non-healthy diet, healthy foods as well. Looking at what WFP is doing, we have in trying to, the overall aim is to fight hunger, but also from ensuring that people have access to the essential needs. So more and more, the organization is switching to defining the value of the food basket or the composition of the food basket, whether it's through cash-based transfer or a direct food distribution, by incorporating tools that allow to understand what are the limitations in terms of nutrient intake and the type of foods that people have available and also exist in the market. And I'm referring to the minimum expenditure basket, which then combines with can be combined with the cost of diet analysis as well. In our cash-based transfer approaches, we also incorporate an SBCC activities. In Mozambique, we have a nutrition campaign, SBC campaign called NutriSing, Say Yes to Nutrition. And the whole aim is to influence the demand side, the beneficiaries, but as well as working with the retailers to ensure that they have the possible wide range of foods available into their local market. And they also promote the consumption, the redemption of the either the voucher or the cash with this food. Food fortification is also another important area that was already mentioned. I won't dedicate much on this. And then using, promoting that local producers are also part of or feed the global supply chain mechanism for food purchases to be used for food aid in the region as well. And this has been increasing more and more. And then in addition, we have the homegrown school feeding program that gradually is expanding the purchases of locally foods produced. And this is mainly perishable foods. I'm concerned about the time, so I'll stop now, and I'm sure we will have time to contribute more into the Q&A section. Over to you, Patrick.
Thank you, Edna. Really interesting additional perspective there to bring to the table. So thank you. Look, all of you as speakers providing initial comments. I'm going to ask Shibani Ghosh to come back on board here, and we'll try and facilitate a bit more group discussion. And what can we learn from across and between the experiences, not just by country, but by region as well. Shibani, I'm going to just, do you want to lead off on this? I'm happy to otherwise.
Sure. I actually had a sort of based on what Edna sort of highlighted, which is a very critical issue of double burden. I was just thinking that it would be interesting to maybe ask our panelists, and then Patrick, this is just the one question I have, and then I'll hand it over. But you know, what needs to be done to support consumers, but also to shift producers and vendors away from these aspirational foods? And I know folks in the chat box have indicated that in some instances, or maybe it was in the Q&A, Tom Van Morik indicated that in Mali and Niger, they're not finding that much expenditure on ultra-processed foods. But I think we all agree that there is these become aspirational foods for the consumer. And how do you shift people away from that? And that's really my question. I want to open it out to whoever would like to answer it, Patrick, but that would be where I would want to start.
How to shift
consumers away, or you know, consumers away from what have become aspirational foods.
Yeah, Atul
has like to yeah, thank you. I mean, in fact, we have been doing this at Balio, Nepal at the moment, as I said earlier about the aspirational marketing. You know, so when I look at this, say for example, an advertisement for a soda drink, where people take their bike and after drinking a soda drink, they can climb to the Mount Everest. Okay, so these kind of marketing campaigns, we need those things. I mean, it's not only for those commercial. I mean, if we really want healthy processed foods to be consumed by the consumers, they should really how do I say, to instigate this behavior change. We have to have this kind of aspirational thoughts. Like we are also working with the retailers. We are building retailers, the point of sale as the nutrition champions. The school children, we are also building a dream for the students that they can be the world champion if they eat nutritious and safe food. So those kind of multifaceted, multi-pronged approach using FCSVs, using local FMs everywhere. It's not just a silver bullet. Lots of things should be done. That's from my side. Thanks.
Indeed, Atul. I've tried to climb Mount Everest drinking soda and it didn't work. So
I think Dave has his hand.
David.
Dave, yeah.
I would just, yeah, I agree. I mean, but I think we're competing against large corporations that have a very large budget to influence consumer preferences, right? And we're probably competing against human biology, wanting energy, our bodies wanting energy dense foods and this type of thing. So, we need to do a lot of applied randomized control research on messaging, the message themselves, the modes of delivery, what impact it really has. But then I think we also need to learn from regulatory and labeling experiences going on in other parts of the world. So Chile's much simplified front of package warning labels, right? And the impacts that is having versus labels that look very similar in other countries, but are much more complicated actually have more information and are harder for a consumer to digest. And the research suggests have less impact than these much simpler kinds of front of pack labeling. So again, some learning from these experiences and experimenting more with labeling in addition to messaging.
Yeah, no, absolutely, David. And in fact, Edna, I was going to call on you because you actually explicitly mentioned SBC and say yes to nutrition, but that is in the context of much better funded advertising and marketing. And you mentioned in the chat there regulation of marketing. But do you want to say a bit more about that?
Yeah, I actually want to complement my answer in the chat and fully agree with Professor David. I think we need to learn from these big enterprises and how they do their marketing and how they invest on it from a nutrition point of view. Sorry, do I have my camera on? I do have. Okay, sorry.
Yes.
I think packaging is a critical issue. So what we have noticed in Mozambique, and I'm sure this is similar in other countries as well, is that the big companies, and I'm not going to say give examples, they are investing substantially in smaller packages. And this is because they know that poor consumers, they depend on a daily purchases for their own consumption. They don't purchase big amounts to store for the whole month as middle or high income families do. So how do we invest in packaging for perishable nutritious foods that can be regularly purchased at the affordable, and they are affordable to these consumers. So that's a key component. And then of course we really need regulations to limit the availability of these products where the people don't use to consume it. Over.
Absolutely. And of course packaging, small outlets that allow people daily purchases, really important, but very hard to label and hard to regulate in some ways. And a lot of this relates to the food safety issue, and the trust I mentioned between the consumer and the retail source, as David was talking about. And we do need to know a lot more about this. Ramji, you have your hand up.
Yeah, I think, I was just thinking, like in Nepal and other developing country, right? You talk about all this advertisement, and other things, and that add cost, right? So when you think about, poor and vulnerable groups, right? And at the same time, you talk about, this packaging and, advertising, right? So you have to be very careful. Are we depriving them from those foods? We are really wanted them. That's one of the things. And I like the Edna one, because in India, I think I remember one time when I was working there, we did some of those things for the shampoo, because it used to come in a big bottle. Then we packed into a small, for hygiene, for sanitation. So we packed in a small, like the 50 paisa, what do you call, a packet, right? And it really, everybody has started buying it, So yes, that's also one of the strategy. But again, we have to think about the cost, I think, and who we are targeting.
Absolutely, always keep cost there, and affordability of these foods has come up many times, and you have to absolutely keep that in mind. Sophie, I was in fact going to call on you because for example, let me just ask you, in your national dialogues in Malawi, for example, how much demand, consumer demand, local demand was voiced in the context of those dialogues for either nutrient-rich foods or any other kinds of foods? What do people voice in terms of what they want to eat?
Thank you so much. What came out of the dialogues is that through even the chiefs and the local communities, there was an outcry to say how can those who are producing access the right financing, a very high demand on the right kinds of foods, but also locally not comfortable to just introduce the hybrids and other crop products, but maintaining like millet, sorghum, pigeon peas, which they have grown up with and which can be affordable and readily grown in their ecological zones. So that came out strongly, balancing between the processed food from factories and then locally produced. But also always a complaint on the processor side saying we don't have capacity to process the right volumes because we don't have the needed raw materials from the suppliers and the producers themselves as smallholder farmers. But the smallholder farmer complains about the lack of the market. So there is like no connection between the two. So what systems should we put in place or facilitate to support linking the producer off-taker with the off-taker and processor in the factories? But also trying to demand that the policies should support, investments by the private sector. The private sector always complains to feel like they are not included in this process and their needs are not really taken on board because the laws like Control of Goods Act, export, mandates, and the taxes that are triggered on these businesses need to be aligned to their needs. Yeah, let me stop there. Thank you.
So this linking, this connecting of dots between private and public sector, I mean, whose responsibility is that? How do we achieve traction in that space? How do we get it done beyond saying this would be a good idea?
It starts from the priorities that we set, understanding that there's an issue here. How do we ensure that we incorporate in our strategies the role of the private sector? And also business development services. Some of these investors do not have adequate knowledge even to package a business plan and sell it to the bank, for example, or a development finance institution. And the development finance institutions also saying the agriculture sector is not that attractive for us to provide the needed financing. And so coming in there, AGRA tries to curb the risk on the supplier and demand side. And so it should be a risk-sharing facility to agricultural lending. And also piloting, like now we have the Malawi Agriculture Investment and Industrial Corporation, which is working with the agro dealerships on the ground that distribute inputs as well as the support aggregation. And to be able to have that stocking capacity and also distribute to the last mile, reducing the distance between where the population is to where they can access the food products or the inputs to produce. their commodities. So it's about really addressing those issues on both sides. Yeah.
So reducing the cost of doing business, the
Yes, to
transaction
reduce
cost,
the
not just of the producer,
efficiency.
but the consumer as well. Yeah. I know, Monsieur, you have your hand up, and in fact, I was going to ask in that context of what was just being said, to what extent does the Food Safety Authority engage beyond protection, right? Minimizing risk or preventing bad things from happening. Does it also seek a more proactive promotion of healthy things and good things to happen? Is that part of your remit?
Yeah, thank you, Patrick. Absolutely. If you look into the Food Safety Act, definitely we have the main mandate for ensuring safe food for the people, but there are a lot of proactive and mandates we are doing, especially to advocate the people for having nutritious food, to change the food habits, actually, and to educate the much people how they can preserve their food, how safely, how they can take their food nutritiously. These are the things we are doing in the Bangladesh Food Safety Authority. If I talk about, the issues of nutrition deficiencies in South Asian countries, especially in Bangladesh, what are the root causes? I think we need to investigate and do research why the children are getting stunted, or why people are getting not proper nutrition. Actually, this is not the issue that you don't buy the nutritious food. There are other issues are related. You see, the people in Bangladesh, we are taking a lot of carbohydrate. The proportion of taking carbohydrate is very high in comparison to taking the fibers, the fruits, the vegetables, green salads. We have the fiber rich foods very cheap in Bangladesh, but the food consumption habit is not that much healthy. So these are the issues, actually the root cause for having the malnutrition, not the issue that we cannot buy food. This is the secondary issue. So I think it is important to have a good database, to have a good research why some of the portions of the children in gender, maybe the girls are more vulnerable to boys. What are the peoples are suffering more? The pregnant women, the elderlies. What are the causes to have the nutrition deficiency? That kind of research and innovation is very important. It's not that the country is poor or they don't have sufficient purchase capacity. It is a secondary issue. But personally, I know that the issues are lying misconception and prejudices, and some other issues are there. So Bangladesh government is trying to advocate people, much awareness, and Food Safety Authority is also doing a lot of, these kind of involvements. And you mentioned that processed foods, which are healthy, which are not healthy, marketing issues, labeling issues, there are a lot of tricky issues in every country. So I think a lot of policy, proper intervention, and proper research, root cause analysis, and policy based on science-based research is very important. And these are the areas we have to look into. Thank you.
And it sounds like the work that you're doing and evolving is something we could look to for lessons in other contexts. Shivani.
Yes, thank you. And, I think it's these are really fascinating conversations. And I want to highlight that people look in the chat box, because there's a lot of engagement and interaction happening on who should take the leadership on connecting the dots between public and private sector. But I just want to move on to some questions that have come in the Q&A. And particularly, there are two questions, Dr. Kiran, for you that I would like to ask if you could answer. One is from Gopinath Radhakrishnan, who asks, has there been any attempt made to measure the government contribution in terms of subsidies to the minimal cost of $2.64. That's the cost of the nutritious, affordable diet. And that's another question that is from Kemraj around data and disaggregated data. His comment or her comment is that we do not have micro level area specific disaggregated data to have targeted addressing, but we're rather working in a blanket approach. So are there any interventions that are location or area specific that may be effective? So if you don't mind answering these two questions, I'd appreciate it.
Thank you, Sibaniji. Thank you very much. Very enlightening, discussion going on. And as a student of this area, I'm enriching myself today. Thank you very much for this important opportunity. Actually, yeah, I fully agree with Gopinathji and Khemji that so far we have a sort of blanket approach, one size fits all approach, and we realized lately that that is not going to work in case of Nepal. I will give you an example. Over the period of time, we have reduced stunting massively from almost 58% in 2001 to 2022. It's around now 31-32%. We have done a lot, but if you see the data of wasting, there is a zigzag. If you go to the sketch, still 12% around, which used to be around 10, almost 5 years back. So something we need to really do while we are framing up, multi-sector nutrition plan third. So from this very year, this fiscal year, we thought that we need to have, some sort of targeted approach. So by covering the district, maybe Patrick knows about the geography, Chithon, Makwanpur, and Dhading, there is a community called Chipan. So we thought, why not to, focus them and target them and have a special, a packaged program against the malnutrition among Chipang communities. And there are Chamar and other Dalits in Tarai, plain areas. So we are thinking to have, targeted, approach to target those communities. So regarding this, the availability of the food, I was highlighting the affordability issue. Actually, we had a fill the nutrient gap analysis with the support of World Food Program, and we came to the conclusion that still there is a large segment of the population who cannot afford even low cost nutritious diet. So we thought that we need to do something from that perspective. We do have some intervention at the moment, and we are trying to scale up. For example, midday meal, covering huge number of students who go to the school, starting up to the grade 6. Government has extended to one more class grade this year. And another is nutrition cash grant that is also going on at the moment, especially for the children. Children from the downtrodden communities, especially Dalit communities, and also the two children from the Karnali province, which is very, very far-flung and poor in all indicators. And we also have been trying to have livelihood option for women groups by providing them microcredit so that they can generate some employment opportunities. And more than that, after moving towards federalism, we have subnational government, provincial government, and local government. So they have been providing, some sort of relaxation in the chemical fertilizer and agriculture inputs and so on and so forth. So these are some of the areas we have been trying to, have some sort of interventions, but it's still, I feel that it's evolutionary process, and we need to do more. For example, Dr. Khem pointed a very pertinent issue here. Even in the affluent families, the kids are stunted or wasted, whereas in poor families, kids are better than those kids from the rich families. So that also demands us to be context specific and area specific, location specific, and communities specific. Regarding the data, this is really a challenging job for us, and we want help from international communities as well, which I highlighted in our previous discussion as well. And as a member of the Scaling Up Nutrition Movement Executive Committee, I have been highlighting this fact. Actually, we need a lot of resources and efforts to inculcate the issue of agenda in the planning process of all the sub-national government, because it is no more a united state of government, and we have 753 local government in place, and we have to align this agenda in the planning process of the local level. And one of the most important agenda, as we have been focusing today on evidence, anecdotal in the planning process, in the policy formulation process. So we have been trying, and recently we have carried out a census. We are getting, data at a larger domain this time, and we are also thinking to have the data better managed while we're moving forward to multi-sector nutrition plan third. With this, I would be back to you, Sivan. Thank you.
Thank you, Kiranji, very much. And I think we have one question also for Ramji from Nahlal Bayari about what are the steps that Nepal has taken to ensure the quality of food products that support health and nutrition. Ramji, are you?
Yeah, thank you, Shivani. I think, as I mentioned, there in policy, you can see that they talk about the quality, right? And how the quality can be assured, right? But in implementation, we don't see much on that one, right? So to answer, his question that in Nepal, we have a good policy, right? We really need to implement it. In some places, it has been implemented, but not much, So that's where I also think that, the academic institute is very important, because there people can look at the local food, and look at the safety, and then see contamination, and then see how they can really do some kind of studies and research and show them that, how the quality can be improved, right? But that still has to be done. That's what I think. Thank you.
Great, thank you. Patrick, I don't know if I had one comment from the chat box I felt I wanted to highlight, and then over to you then maybe. Yeah, I think there was a little conversation between Nahala and David about the, Nahala Al-Bayari made a point about in Jordan, when you buy in bulk, even like something like eggs, they cost less than when you buy 2 or 3 units. And I think the issue, and that's what I want to sort of pose to our panelists, that the issue related to the bulk buying is linked to infrastructure, isn't it? That if you're able to bring down the price of the product, you're likely to be able to sell in bulk. But the issue is that we can't actually bring down the price if there's not the infrastructure. So I thought this was a very interesting conversation between Nahala and David, because I know for a fact that often people cannot even afford that one egg, let alone being able to buy. The cost of eggs doesn't reduce because they're going to be buying it in bulk in many of the contexts we work in. So sorry, I kind of wanted to highlight that and say, if anybody has any thoughts about how, within their context, what does that mean, buying in bulk, particularly nutrient-dense foods? Ramji.
I think, the idea is good, because here also in Nepal, if you buy in bulk, right, the price is always, will be low, right? But again, question comes, looking at our target group, which we are talking about, they may not be able to buy in bulk, right? They cannot buy for a month or for a week, right? So for them, I think this kind of a strategy may not work unless, like, I don't know, there is a community or cooperative who can buy in bulk, right? And then they, they sell or provide, in in that low cost, to the vulnerable groups, right? That could be another strategy can be done, right? Otherwise, buying bulk definitely cost will be low, right? But the question always comes, can they afford it? For example, I can give you, when I was in the States, we 6-7 students getting together and go and buy in Haymarket in bulk, right?
Yeah.
So it was very cheap, right?
Yeah.
But then we have to wait for people to get together, right? And go there and buy it. So that's the constraint.
Yeah. I think, Atul, you had your hand up, but I also see Zaman. I do feel, I think the issue with bulk pricing is not something that is easily addressed. I think it is very much linked to being able to produce in bulk, and therefore buying in bulk will be cheaper. That's my 2 cents here. But Zaman, please go ahead. I know Atul put his hand down.
Yeah, just a quick comments like, definitely egg is a nutrition-dense food, and we are talking about plant sources, but we should not forget that we focus more on the also like animal sources of food. So egg is one of the most common, affordable, if we can make it available at the local level. So my question is that not only for egg, all the foods are like, bulk is always cheaper than small quantity. It's for all types of food. So my comments is that small group, if we talk, then I think the best solution is that why don't you try produce it locally? And we have the data, and we have seen those who have the access to egg locally through the home production, the consumption is higher than purchasing from outside. So we rather encourage egg production is not a difficult thing. It's a at the homestead level, easily like every week 2 to 3 eggs production or 5 eggs production is not a difficult part. So I think that we should focus more on this. Thanks. Over to you, Shivani.
Thanks, Zaman. I'm going to hand it over to Patrick, whom I know has a series of questions emerging on his end.
I thought you were going to say, that I produce 5 or 6 eggs every day.
I was going to say that actually. Patrick produces 5 or 6 eggs a day, people.
Yeah, well, a small flock, but that's not the problem. But getting those eggs to people who need them and want them, that's the bigger challenge. I was just going to ask Gaspar, in fact, really drawing on something that Dr. Kiran mentioned around how do we connect scientists and policymakers, because he mentioned gaps between research and in terms of evidence and practitioners. And Gaspar, you mentioned the need to build awareness among policymakers of what they really should be doing and finding ways to do it. But how? Can you just elaborate a little bit more on that really important science or evidence to policy and practice linkage?
Okay, thank you for the question. In fact, the aspect of linking the aspects of research with policy, I mean, it's all the question of trying to find a link where the research is doing its work, to find innovative ways to foster new ways of production and new ways of making sure that the nutritious food can be available to the public and with quality and safety. And what the gaps that are there is the fact that, because of funding issues, finance, the area of research does not have the resources that it needs to do the work. And the governments or policymakers have to be sensitized to consider this as a very important element for them to make sure that they make the link between the producers until the consumers, to find the results, the innovative results for the problems that are there. So when I would say, for instance, there has been a lot of research amongst big companies working in the ultra-processed food. They are the one who are making sure that all these products reach the poorest, even in the rural areas, in small packages, and with very good packaging. But how can we try to work and support those and even incentivize the private sector to turn that focus into the nutritious food and make sure that the nutritious food is available in rural areas in the same way? As Edna was saying, in Mozambique, if you talk about bulk, it's nothing. And the market have understood that. So if we could have the research that works in terms of making sure that the foods it's processed and the nutritious value is preserved and it reaches the consumer. So our concern is to reach the most vulnerable person. So there must be a synchrony, a connection from the policymaker, the research, the private sector, until the consumer. And the consumer have to be taught to demand for nutritious food of quality that has quality and safety.
Nice way to put it. Thanks, Casper. I'm unfortunately going to have to wrap up. I would love to spend another couple of hours exploring, not just these issues, but what they imply for allowing that synchronicity to actually occur, right, across all those players across the value chain, including workforce development, and very, very specifically, where do we try and build capacity? Capacity for whom to do what? A lot of really important issues here. I mean, some of I'm not going to distill, but it was striking to me how much resonance there was across most of these, if not all of these, comments about both the potential as well as the challenge, and the link. A common thread throughout was find the right evidence at the right level, at the right season, in the right context, and feed that into sensitization, not just of policymakers, but of consumers, of those involved in value chain activities and so on. There are a lot of challenges that we face. A lot of them came up around infrastructure, financing, the needs in that space, needs around evidence, that the kinds of evidence that can support policy, but also support commercial entities to make the right kinds of investments. And then evidence that consumers themselves, through labeling or other, need to make the right choices, informed choices. There's needs relating to funding at all levels, funding for innovation, funding for research, funding for the capacity to enable systems to work better. There's policy needs around not just marketing regulation, but more broadly, connecting the dots across sectors to achieve the synchronicity that Casper was just getting at. These are all challenges, but they also represent opportunities. And these are opportunities we can't afford to waste. So this is the start of a discussion, certainly not the end, not a one-off. I think there's so much has been put on the table that we can digest this, and in the next few years, hopefully work together, come back more often to figure out the solutions, not just the problems. So I want to thank, obviously, FAO for organizing this week on science and innovation and technology. But all the amazing panelists and speakers we've heard from today. Thank you so much for sharing some of your time in doing this and sharing your insights. Thank you to the Food Systems for Innovation Lab staff, making it happen in the background of all the participants who've engaged so actively in the chat and in sharing questions. This is the beginning of this discussion, and we welcome everyone to be part of the journey and look forward to further opportunities to engage. Thank you from me, and also from Shabani, I'm sure.
Thank you, everybody, very much.
So
Thank
be
you.
safe and well,
Thank you.
and we will share the recording and what comes out of this, and look forward to future interactions in this.
Thank
in this
you.
domain.
Thank
Thank
you
you.
all.
Thank you very
Thank
much.
Bye, everybody.
Bye.
Thank you. Bye-bye.
Bye.